In this lecture, we'll cover blood types and blood typing. So the most popular blood typing system is the ABO blood system. We have two antigens, A antigen and B antigen, and this technically gives us 4 different ABO blood types. We have type A, type B, type AB, and type O. So what are we talking about? What do we mean? Okay. Antigens are proteins or other molecules on our blood surface and our cell surfaces. Okay. So type A has a specific shape. Type B has a specific shape. Type AB, notice we have both shapes. Okay, so this is not a type C. It's not a blend of the shapes. You have both type A and type B antigens here. Now type O, we have no antigens here. We have no A antigens or B antigens. Okay. Blood types are inherited, so you will receive some sort of combination of alleles from your parents. The A, the B, you might get one of each and end up with AB, or you might not get any and you would end up with type O from your parents. Now, we just mentioned that the antigens are proteins on the surface of your red blood cells that can cause agglutination, which really just means clumping. This really only happens if the immune system thinks that those antigens are foreign. So we do have self-antigens. So if you are type A blood, your A antigens, this is a self-antigen for you. If you are B blood, then this B antigen is a self-antigen for you. Okay? If you are AB, then your body recognizes the A antigen and the B antigen. Okay? These are both self-antigens for you. Okay? Then there are non-self antigens. Okay? Your body should recognize these as foreign, which will trigger an immune response. Okay? Viruses and bacteria also have their own antigens, and these are hopefully recognized as foreign. This triggers an immune reaction, so your body tries to destroy these. Now, if we go back to our image, if you have type A blood, this A antigen is your self-antigen. Okay? If we gave you B blood, your body doesn't know this antigen. It's not familiar with it. It would recognize it as foreign, and it would want to destroy it. This would trigger an immune response. And vice versa. If you are type B blood, this B antigen would be your self-antigen. If we introduced A blood into your body would recognize that as foreign and it would want to destroy it. Okay? If you had type O blood, okay, your body would not be familiar with either the A or the B antigen. You have no self-antigens on your blood. So if you gave any of these antigens to a type O patient, then their body would not recognize those antigens. They would be considered foreign, and your body would trigger an immune response. Now, in addition to having antigens, and keep in mind, antigens are what are on the surface of the red blood cell. So if we go back to our image, these A's and these B's, these are all on your little red blood cells. Okay? That's different than antibodies. Okay? Antibodies are created by your lymphocytes, your B lymphocytes, specifically B cells. Their job is to identify and attack foreign antigens, those non-self antigens. Okay? Each antibody is very specific. Okay, so one antibody attacks one specific type of antigen, and when the antibody attacks the antigen, it forms clumps, and we refer to that as agglutination. Okay? Agglutination also promotes hemolysis, so we would also end up destroying those blood cells. So if we go back to our image, okay, so we said antigens are on the red blood cells themselves, okay, the A's and the B's. Antibodies, these guys, okay, would be floating around in your blood plasma. Okay, so if you have type A blood and you have the A antigen, this is your self-antigen. Okay? you would not want to make A antibodies because A antibodies would attack your A antigen. Instead, you would want to have B antibodies floating around. Okay, these would be in search of any B antigens that made their way into your body, and we would want to attack those B antigens. We would have agglutination. Now, if you had B blood, remember B is your self-antigen, that's what your body recognizes. So we wouldn't want B antibodies to attack us, we would want A antigens to attack any A antigens that would be foreign, okay? Now, if you have AB blood, your body recognizes both A and B antigens as self-antigens, so you wouldn't need any antibodies for these two antigens. Okay? And then last but not least, if you had type O blood, okay, your body does not recognize A antigen or B antigen, so you would have both antibodies. So again, if we gave a type O person A blood, B blood, or AB blood, okay, their body does not recognize any of that. They would have antibodies that would then go on and agglutinate with any or all of those antigens that make their way into that body. Okay. All right. So this is kind of what an antigen and an antibody look like. So our antibody is this Y shape, okay, and the antigen, the shape is complementary to the antibody. Okay. So notice that we've just got different shapes for antigens and different shapes for antibodies, but the antibody antigen, the shape is always complementary. Okay, so if the circle with the little box, if that's maybe an A antigen, that particular shape, an A antigen and anti-antibody, this would be the B. Okay, this is a different shape. Okay. All right, so this is kind of what agglutination looks like. Okay, that's our fancy science word. It really just means your blood's clumping. Yeah, your blood's clumping together. It should make perfect sense to you that these clumps are not going to be able to move through your blood vessels very easily, especially your smaller venules, your capillaries, your small arterioles, things like that. So this can cause a lot of problems if this happens to a great deal. Okay, so let's try to reinforce this idea of blood types. Okay. We've said them out loud, let's get them into writing. So type A blood, if you are type A, your red blood cells have only the A antigen. Okay. You would not want anti-A antibodies because anti-A antibodies would attack your A antigen. We don't want that. So instead we'll have anti-B antibodies. Okay. So if your A antigen body comes into contact with B antigen, your B antibodies would destroy it. Now, if you're type B instead, we have the B antigen on the red blood cells. We would have anti-A antibodies, and the body would not recognize the A antigen as being self-antigen, so it will destroy it. We mentioned that type AB blood has both A and B antigens, so there's no need for antibodies because your body recognizes both of those as self-antigens. While type O has neither A or B antigens. Okay. There is no O antigen. Remember, it's just an absence of the A and B antigens. So we would have both anti-A and anti-B antibodies. Okay. Your body would not recognize either A or B antigens as being self-antigens, so those antibodies would want to destroy those. Now, most people also, when they talk about blood type, especially when they talk about they're like, oh, I'm B positive, or oh, I'm A negative. Okay, so what is the positive and the negative? We've got one more antigen. It's an Rh antigen. Okay, you either have it or you don't. Okay, if you are B positive, okay, then you have both the B antigen and the Rh antigen. If you are A negative, then you have the A antigen, but you don't have the Rh antigen. Okay, so if we go back to our image, okay, so if you are A negative, this is what you would look like, and this is it. You'd have the A antigens, the end. Okay, you would also have Rh antibodies because your body would not recognize those Rh antigens if it comes into contact with them. But now if you had B positive blood in addition to all these little B's, you would have another little set of antigens right here next to these. Okay, so imagine a little stick with the circle with an RH written in it. Okay, you would also have those right next to it. So if you had AB positive blood, you've got A's, you've got B's, you would also have RH antigens sitting on your blood cells. Okay, so kind of envision that. Okay, so in all, instead of 4 blood types, we technically have 8. Okay, because we've got A positive, negative, B positive, negative, AB positive, negative, and O positive, negative. Now, the most common type is O positive. The least common is AB negative. Okay. Why do we care? Because at some point we may either decide to donate blood, or we might need to have blood transfused into our own bodies, and we would like that transfusion to not kill us. Okay, because that would be bad. Some of your antibodies that you have in your body, okay, we call them immunoglobulins. We have G and M, so IgG and IgM. These are naturally occurring, so you're just kind of born with these, and we'll discuss those a little bit more in the immune system lectures. But your anti-A, your anti-B, your anti-RHs, okay, these are also naturally occurring. Okay, so you're just kind of born knowing which of these are self-antigens and which ones you would need to make antibodies for. Okay, so how do we figure out what blood type you have? Well, we do a blood typing. Okay, we test your blood. Now, put blood typing in that category of things that students always struggle with. Okay, they just always struggle with it. Now, here's one of the hardest things to keep in mind. We have just spent however many minutes talking about how agglutination is bad. We don't want to see clumping. Agglutination is bad. Agglutination is bad. We don't want to see clumping. And that is 100% accurate inside your body. We never want anything to clump inside your body. But when we do your blood typing, we don't do it inside of your body. We do it outside. We do it in the lab. Okay? So keep that in mind. Okay? So when we do your blood types, we are actually looking for clumps. I know, I'm blowing your mind. I know. Okay. So let's talk through that. Inside of your body, when do we get clumping? We get clumping when an antibody binds to an antigen. Okay, so you had anti-A antibody in your blood, and you exposed it to a antigen. You would have clumping. We don't want that in your body, and that's totally true. Still totally true. Okay, but if you remember, these little antigens, these little antibodies, they're all so tiny. Okay, so how do we see them? Really, the only way to see them is for them to all clump up. Okay? So outside of your body, when we're trying to figure out what antigens are inside of your blood and in your blood plasma and all that good stuff, what do you have going on? We want to see clumps. Okay? So if you have type A blood, okay, this is your self-antigen, right? You would have A antigen on your little red blood cells. Okay. You would not normally have anti-A antibodies in your blood because your anti-A antibodies would bind to your A antigens and you would get clumping in your body. We don't want that in our bodies. Okay? But remember, this is outside your body. This is in a lab. So how are we going to see those A antigens? Well, those anti-A antibodies are going to bind to those A antigens and we're going to have clumping. Okay, this is really just letting us see what's already in our blood. Okay, now since you have the A antigen, okay, you will not see a reaction with the anti-B antibody. This antibody would not recognize your A antigen. You would have no reaction here. Okay, so this lack of clumping tells you that you do not have the B antigen. Okay, this clumping tells you that you do have the A antigen. Okay, so this tells you that this person has A blood. Okay. Now, if we had a third column here for the Rh factor, if we also saw clumps in the Rh factor, then that patient would be A positive. If there was no clumping in the Rh, then this patient would be A negative. Okay. Again, this is one of the hardest concepts for students to wrap their minds around, because we keep saying, oh, clumping's bad, and then all of a sudden we're looking for clumping. Okay? You've got to keep in mind, blood typing happens outside of your body. Okay? And we are looking to see what would be inside of your body. The only way we can see that is to see what is clumping outside. Okay? So again, anytime you see a blood type, anytime you see pictures like this, okay, real ones or, cartoon pictures, anything like that, okay, when you see pictures like this, clumping is a positive reaction. Write that letter down. Because somebody's going to say, hey, look at this picture. What blood type does this patient have? Okay, if it clumps, write that down. This patient is A blood. And again, if there was an Rh, if there's clumps in Rh, hey, write that down. We're A positive. Okay? All right, again, why do we care? Because at some point, you may need to give or receive blood. We would like to do that correctly. Okay? Because again, we don't want agglutination inside of our bodies. Okay? You cannot receive blood safely that contains an antigen that you are not already familiar with. Okay? So if you are A positive, we're not going to need to give you B positive blood, right? Because your body's not going to recognize that B antigen; it will destroy it. Okay. Now, people with AB negative, okay, and AB positive are really good at being plasma donors, universal plasma donors. Okay, so you can transplant or transfuse, I should say, blood, and you can also transfuse plasma. Okay, so if you have AB blood, okay, you would have both A and B antigens on that blood. But remember, where are the antibodies? The antibodies are in the plasma. Okay, so if you have AB blood, you would have no antibodies in your plasma. So we could give you AB plasma, which would contain no antibodies, which would then not be able to go on and attack your blood cells. Ooh, I know. Think about that one. This is just kind of a cartoon representation of what would happen if you introduced the incorrect blood type into somebody. Your antibodies would attack it. We're going to see agglutination, we're going to see clumping, and eventually we would just destroy those red blood cells. All right, just a quick chart. Okay, so you will be asked to figure out, oh, can, this patient donate or receive blood from this person, and you will have to figure out whether or not that's possible. Okay, so one of the things to keep in mind is make sure you're figuring out who is the recipient or who is getting the blood, and which of the patients is the donor or who is giving their blood. Okay, because sometimes it can go both ways, right? So if your patient is A positive, if your recipient is A positive, and your donor is A positive, okay, then that's no big deal. Okay, but if your patient is A negative, notice that they cannot receive from an A positive donor. But if your recipient's A positive, they could receive from an A negative donor. Ooh, I know, things are getting complicated. Okay, so why would that be the case? Okay, if you are A negative, your body would not recognize the Rh factor, would not recognize that Rh antigen, so you would not be able to receive blood from an Rh positive donor. Alright, this is also important when we talk about pregnant mothers with their fetuses. There is a condition known as erythroblastosis fetalis. This can be pretty nasty. This happens when an Rh negative mother gives birth to an Rh positive fetus. During the delivery, you're going to have a little bit of mixing of blood of the fetus with the mom. This is definitely going to stimulate her immune system to produce the Rh antibodies. So if she was not previously exposed to Rh antigens, she is now. So she's definitely for sure going to have these antibodies now. So typically the first pregnancy, it's really not that bad. The reaction is fairly mild. You're not going to have a whole lot of mixing of the blood. You won't have that big of a reaction. But if mom gets pregnant again with another Rh positive baby, then we're going to have to work a little harder to make sure there's no reactions there. So we can supplement with a row gam shot or an immunoglobulin shot to prevent antibodies from finding fetal tissue cells. And if they do find the fetal cells in the maternal circulation, then you would have that agglutination, and we don't want that. Okay, so if it happens a second time, we have to work a little bit harder to make sure nothing goes too terribly wrong. And so you can kind of see here, first pregnancy, we're creating more of those antibodies. So the second pregnancy, the antibodies would already be there, and so we don't want them attacking the fetus or even any of the blood cells that might have gotten into mom by accident. Alright, just a few more images of what would happen if you gave somebody the incorrect blood type. No agglutination if we do it correctly, lots of agglutination if we do it incorrectly. Universal donors and recipients. If you have O negative blood, I am sure that the Red Cross hounds you, probably calls you every couple of weeks asking for you to come in and donate blood, because if you are O negative, then you have no surface antigens, you have no A, no B, no Rh. You can really donate to anybody. Okay, there's nothing on your red blood cells that would really bother any patient that needed to take your blood. And then if you are AB positive, you're the universal recipient. You can take blood from anybody because your body recognizes the A antigen, the B antigen, and the Rh antigen. Okay. Now, matching is still the safest. It's still ideal, but in an emergency, the O negative is really especially what gets stockpiled. Alright, just our last few images of what these blood types would look like, the percentage of the population, what antibodies they would have, who they can receive and donate from. Alright, so that concludes our blood typing lecture.